You're listening to the Sick and Good podcast. My name is Dustin Messick. I'm a registered dietitian, nutritionist, and a cancer survivor.
My name is Colin Goodwin. I'm a clinical psychologist and a cancer survivor.
In 2024, we are highlighting the Cancer Awareness Month in a special series.
We're promoting wellness by having discussions on screening, treatment, and recovery throughout the cancer journey.
To find a balance between sick and good.
That during the cancer process, both can be true.
The Sick and Good podcast is for educational purposes only. The podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regimen. September is Thyroid Cancer Awareness Month. And to celebrate this, our special guest is Julia Diaz. Julia is a passionate and dedicated registered dietitian with a broad spectrum of expertise and interests. Her key areas of passion include thyroid cancer, transforming healthcare, reducing food waste, and reframing nutrition from restriction to possibilities. Additionally, Julia aspires to become a polyglot, constantly learning new languages to better serve her diverse clientele. Welcome to the Sick and Good podcast, Julia. It's great to have you on.
Thank you so much for having me. I appreciate it.
Can you share with us what led you down your career path?
So what led me down my career path is my own personal journey with getting thyroid cancer myself, completely unexpected because I never had any symptoms that I was aware of for thyroid cancer. And the best thing that ever happened to me was my dad losing his job so that it triggered for me to go in to get annual checkup, to get my eyes checked, my teeth checked, blah, 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 before switching over to my mom's health insurance because I was about 20 years old. And because of that, when I went into my primary care appointment, they found a lump in my neck, got blood work, ordered an ultrasound. Ultrasound showed that I had nodule with calcifications. They ordered a biopsy to confirm. And so then I had papillary thyroid cancer based on that confirmation. I've had a thyroidectomy, a complete thyroidectomy, and my story is completely long, but to fast forward it pretty much is that I've had a thyroidectomy and I've had multiple in the lymph nodes since then. And because of my health experience, and I was already studying to become a registered dietitian, it only enhanced my passion for nutrition, health, and wellness. And I've worked for different hospital systems. I've worked in dialysis. So I've continued to gain knowledge for the whole body system and how it really works and why the thyroid in general is such a vital organ for the entirety of your system, for from hormonal balance and metabolism, and even down to communicating with your brain and thoughts, etc. It just really made me decide to do my own thing and open my own practice as a dedicated thyroid cancer dietitian. So what I specialize in is I guide thyroid cancer warriors and survivors through every stage of their journey. So from diagnosis to long-term recovery, because I have a deep understanding of the unique nutritional challenges faced by those battling with thyroid cancer. And I offer personalized support that goes just beyond diet advice. My mission really is to empower you with the knowledge and tools needed to navigate the complex landscape of thyroid cancer treatment and recovery. So whether a person's preparing for thyroidectomy, gearing up for the low iodine diet, radioactive iodine 131 therapy, or seeking to really optimize their health post-treatment thyroidectomy, I provide expert guidance for their individualistic needs. And because a lot of common nutritional concerns that they can face are like low iron and calcium levels, which I'll talk about later. So my approach, it just really extends a lot beyond just those deficiencies and trying to encourage people to foster more of a holistic lifestyle that supports their overall well-being. And what they really learn, I've had so many different types of clients, but what they really learn is like either to prepare their body nutritionally for thyroidectomy and optimize their faster recovery post-surgery, and prepare them before, during, and after radioactive iodine therapy, and help them really develop a sustainable, nutrient-rich diet that supports their health and beyond.
Well, Julia, can you tell us what are some common risk factors of thyroid cancer?
Yeah, so some common risk factors of thyroid cancer, the most well-known and studied has been radiation exposure. So exposure to radiation, especially during childhood, significantly increases the risk of developing papillary thyroid cancer. Individuals exposed to head and neck radiation treatments, they're at a higher risk. And like the historical data has shown that children exposed to ionizing radiation have up to a 25-fold increased risk. As well as gender, thyroid cancer is more prevalent in women than in men, occurring about 3 times more often in women. But it does occur in men. And what I've been noticing too is that it definitely occurs in transgender when it comes down to transitioning from one gender to the other. With those hormonal changes and hormonal therapy, that's been a risk factor. It's been an increased risk of thyroid cancer from those changes. Definitely age, the risk factor, it's been known to peak for women in their 40s and 50s, and later in men around their 60s and 70s. However, there's a lot more cases now of young adults and especially adolescents with thyroid cancer, and as well as a family history and genetics. So, of course, if there's a family history of like medullary thyroid carcinoma or multiple endocrine, those syndromes face a heightened risk. Like about 5 to 10% of thyroid cancers are familial when it comes down to medullary or multiple endocrine neoplasm. The lesser known risk factors are diet and obesity. So for diet, it's in regions where there's an iodine deficiency, the risk of certain thyroid cancers like follicular thyroid cancer increases. And conversely, excessive iodine can be a risk factor. That would increase the risk of papillary thyroid cancer. When it comes down to being overweight or obese, and what I mean by that is because I'm always really sensitive to, I'm very inclusive with who I work with. So I am not for fat phobia. It's just more so when there's an increased body fat tissue percentage increases risks of cancers, and thyroid cancer is one of them, because BMI sucks. So that's not the overall indicator of health. But when there's an increased body fat tissue percentage, that is associated with a higher risk of developing thyroid cancer. And it contributes to about a 20 to 30% increased risk of thyroid cancer. So I wanted to make that clear of why reducing overall body fat percentage is going to be a beneficial on decreasing thyroid cancer risk and reoccurrence. And other thyroid conditions that are lesser known are stuff like thyroid nodules. There's a lot of thyroid nodules. Thyroid nodules are very common. They don't always indicate that you're going to have thyroid cancer, but it is just a risk factor. And goiter is a risk factor as well as thyroiditis, is that having inflammation of the thyroid is a slightly increased risk factor of thyroid cancer. And last but not least would be some studies, they've suggested some links between thyroid cancer and exposure to certain chemicals, such as pesticides and herbicides or people are always talking about glyphosate. It comes down to the dose is the poison, but the people, the farm workers that are handling these pesticides and herbicides, that has been what's been the most studied. And they're the ones that are at the most increased risk. They've done studies down in farm workers in California that we know of so far. But when it comes down to just eating fruits and veggies, it is such a low risk in that regard. And the data is not definitive. We definitely need more data on that. But that is just something that's always been on my radar ever since I've been diagnosed, is I've been just, always wondering why I got thyroid cancer, because I have no family history and it was extremely random.
Yeah, and to speak to what you're saying earlier about BMI, someone's obese class 2, class 3, above 40, I guess they would probably have a higher risk factor for thyroid cancer from what you're saying.
Yep, that is correct. Yes, along with other metabolic conditions, disease conditions, because if a person is living with diabetes or has been diagnosed with diabetes, from those hormonal imbalances can also increase thyroid cancer risk as well. And absolutely.
Yeah, and if you don't mind me asking, did you fall in the criteria of the textbook risk factors that you just described?
No, because it was not very common to, and what I really think, because of, as a thyroid cancer survivor warrior myself, I don't think that those thoughts will ever stop of how and why. You get better at managing them. At least over the years, I've groomed to making peace with just accepting that it's a part of my story. It's just a chapter of my amazing novels of my life. But I would say I don't have any family history. It was not common for young people to be diagnosed with thyroid cancer. I was never having any thyroid issues to my knowledge. The one thing that I can speak to, though, is I did have a lot of dental work as a kid, and they did not use thyroid guards back then. So I had a lot of dental x-rays that were probably unnecessary, but we didn't know enough back then. I had braces twice and headgear. So I was looking real cool as a kid with big glasses. But I would think that was probably a big factor. And then another thing that I was thinking later in life, when I was a young adult, I used to take multivitamins a lot. And just in the fact that a lot of the time multivitamins, they just have excessive amounts of certain micronutrients, and iodine is already found a lot of the time. And that's why especially in the US, in the Americas, we use iodized salts so that we can prevent goiters, but so that you are able to get a sufficient amount of iodine from our food. And a lot of the time we get packaged food or people eating out and whatnot, but a lot of the time we get enough iodine from the foods that we eat, especially from if we cook at home or if you eat out. It's made with iodized salt. So by taking multivitamins, a lot of the time they'll have extra or more iodine. And so that is the only other thing in question is, did I have too much iodine to promote growth of papillary thyroid cancer? There's no way to truly tell, but I think with the radiation exposure and having unnecessary multivitamin, because I was already healthy I was very active and eating really well and throughout my childhood and studying to be a registered dietitian, that it was again shocking to me to be like, what? It was very out of left field.
Yeah, I could totally see that as a cancer survivor myself. You're just thinking, why did this happen to me? But I do look forward to reading your book, The Thyroid Cancer Warrior, someday when that happens.
Oh yeah, it'll happen.
And just to transition a little bit here, what are the prevalence rates of diagnosis?
So the prevalence rate, so thyroid cancer does not discriminate, and it can occur at any age. But because it's most commonly diagnosed in women and men. But what's been really interesting is that in Australia, there's been approximately about 3,000 people are diagnosed with thyroid cancer each year, and the incidence has been increasing in recent years. But in the United States, thyroid cancer represents about 3.1% of all new cancer diagnoses annually in the United States. But the incidence has been rising, with approximately 56,000 new cases diagnosed annually. And it's the most common endocrine-related cancer.
Wow. So what are some of the subtypes? I know that you talked a little bit about that a little bit earlier.
Yeah, so there are for the longest time there was known for 4 subtypes, but now, so that would be papillary thyroid cancer, follicular thyroid cancer, medullary thyroid cancer, anaplastic thyroid cancer. And then now there's it's been more known and recognized as poorly differentiated thyroid cancer. So there are just the more complex versions, so to speak, than what they say as the typical well-differentiated thyroid cancer, like papillary and follicular. And papillary thyroid cancer, it accounts for about 80 to 85% of all thyroid cancer cases, and it's been known to generally have an excellent prognosis with a high survival rate. And there's different subtypes of that, which are like classical follicular variant, tall cell variants, each with a slight variation in those prognosis and their treatment responses. For follicular thyroid cancer, it's about 10 to 15% of thyroid cancer, which includes Hürthle cell carcinoma, and known for being slightly more aggressive and more recently known as oncolytic. And for medullary thyroid cancer, it makes up about 3% of thyroid cancers, and it can either be sporadic or familial, like I said in the beginning, and it involves C cells rather than follicular cells. So their treatments are different. And with anaplastic thyroid cancer, it accounts for about 1% of cases and is known to be rare, and that's the most highly aggressive thyroid cancer with a poor prognosis. And poorly differentiated thyroid cancer, these ones they have a not as well prognosis as papillary because it doesn't respond as well to radioactive iodine treatment. And so they're coming up with new treatments and how to approach this specific subtype of thyroid cancer.
And that is exactly what I wanted to ask about. I guess I have more of a 2-part question here. I wanted to just hear what the common treatments were for thyroid cancer, and if you could speak to the treatment effects of those treatments. That's
absolutely.
A little redundant, but
yeah, no, absolutely. There's a lot. What's really awesome is that because I'm super nerd, because ever since I got diagnosed, I feel like I've always been looking for the latest and greatest thing. And like, it's really awesome to see how much advancement has come since I've been diagnosed, and which is a promising thing moving forward. So the common treatments, like at least the ways to, common treatments would be after you go in and I should mention actually, like what to look out for. So I'll mention that. But common treatments after going in to see your primary care physician, and then if they notice anything remarkable in the blood work and the ultrasound, you get a fine needle biopsy to determine if they can get that, like a good sample of which type of, and depending on the type of thyroid cancer that you have. But anyway, so the common treatments would be getting a surgery. So a total or a partial thyroidectomy is the primary treatment for papillary and follicular types. And it's successful in over 90% of the cases when it's caught early. So there's different stages of thyroid cancer depending on when it's caught. And there's this whole system on how to categorize and determine that as well. And For papillary and follicular types, especially, radioactive iodine therapy is used post-surgery in about 60 to 70% of cases to destroy residual cancerous cells left over. And it's actually particularly really effective for papillary and follicular types. And after then, and there's also targeted therapy. So this is particularly for like medullary and anaplastic thyroid cancers because it doesn't respond well to traditional treatments, and they work differently and they don't respond to radioactive iodine. So like for medullary thyroid cancer, it involves there's new drugs that have been in the last few years that have been put on the market that are target specific cancer cell mechanisms. So that's been really promising. And they have been also highlighting more external radiation ablation therapy. So sometimes when radioactive iodine is ineffective, this can be used. External radiation therapy can be used for aggressive types for like anaplastic thyroid cancer when the cancer is spread. And sometimes too for anaplastic, because a lot of the time people with thyroid cancer, this is like one of the things like, oh, you just have to get a thyroidectomy and you're good, right? Oh, at least you don't have to do chemo. There are some cases where thyroid cancer warriors have to do chemotherapy, and it's specifically for anaplastic. But they also do, which is new and awesome, at least for depending on the location, if you have papillofollicular, is that depending on the location of where it is on the thyroid gland, if it's more surface level or if it's able to be doing radiation ablation, so it's external radiation therapy as well, so you don't have to do radioactive iodine. It's a little bit more targeted, which is good. But also, when I was diagnosed way back when, what they would always, it was more, they were definitely very more proactive on just removing the thyroid immediately. They were very proactive about doing a total thyroidectomy and doing radioactive iodine treatment, etc. But then the survivorship, which we'll talk about later, but just the fact of just removing a thyroid gland, when what they mentioned is that because these cells are so small and slow growing, depending on the kind that you have, but this is just what the thyroid cancer associations and medical endocrinologists and people that are really well versed in these fields have been mentioning, because and they speak the majority of the time because of the typical growth rate is very slow growing. If we're talking like primary cases are papillary and follicular because of that, and that they don't nowadays. What's super awesome is they don't see it as emergent to remove your thyroid, especially if you're catching it in an earlier stage, of course. It's not as emergent to have to remove your thyroid right away. That active surveillance is a common treatment plan as well. It just comes down to the person, because when anybody, I can understand and relate when anybody hears the word cancer and then it's like option of getting it cut out of your body or active surveillance, you have the choice. Then nobody can actually answer that for you, because there's no way to really know what's going to be the best course of action for you. That's one of the things that's uncontrollable. But active surveillance is actually a good thing if that's a person that is comfortable and confident with their doctors and their treatment plan, and they go to their doctor's appointments, et cetera, that they can do, that they feel comfortable and confident with doing that, then that is something to do, so that at least you can utilize having your thyroid as much as you can, so you don't have to go on to deal with going on thyroid hormone replacement therapy and navigating the challenges of taking thyroid hormone medication every single day and the side effects from that, because that's for life. Once you get your thyroid removed, that's for life, which I'm grateful that there's that option, because otherwise, without a thyroid, you will not survive. So I'm glad that there is thyroid hormone replacement therapy in general for thyroid cancer warriors and survivors.
But you can just take hormone therapy and you're basically like normal, like with the hormones?
No. Yes and no. Let's say that. So it shows that I'm laughing just because that is a very common assumption. But with taking hormone therapy it's absolutely different for everybody. So when it comes down to, some people feel fine, normal, they don't feel any side effects. But a lot of the time, I think the most challenging, especially, is that when you take this hormone replacement therapy, and if your levels are off, and you only get, usually blood work is ordered, since hormonal changes, it's not that they don't happen overnight, because you could eat something that interacts with your thyroid cancer, with your medication, and you won't know the effects if you're blocking if you're taking your medication wrong, so to speak, and if you're drinking coffee too soon, or you're taking your calcium or iron supplement too close to your medication, or you're eating a really high fibrous breakfast close to your medication that could delay its absorption, because you don't get your thyroid labs checked weekly or stuff like that. It's like you don't know until you feel symptoms that something happens. And it takes a while to feel these, it can take a little while to feel these symptoms, but when you make adjustment, and it takes a while to feel these symptoms. When you go and you get your blood work, and if it's, for example, if it shows that if your thyroid is elevated, your thyroid number's elevated, that means you're hypothyroid or low thyroid. And there's a wide range of symptoms you can feel from that, especially fog brain, fatigue, really cold hands and feet. And there's a whole list of symptoms that people can feel. And especially when you're really hypothyroid, you feel a lot of like pain in your joints and your fingers and your ankles. So those could be just a few common signs of many that I just mentioned. But when you get your blood work and then it shows that it's high, you make a lab adjustment on your medication from your doctor. When you make a medication adjustment, when you make your med adjustment, because of the half-life of the medication is relatively quick, your blood work, if you make an increase in your dose, it will show in your blood work relatively quickly, like in about a week or two. If you went in and got tested again and it shows that you got your blood work, you got it tested, so for example, it shows that your labs are quote unquote within range and normal. The doctor is going to be like, oh, great, your labs are normal. It's not thyroid related, whatever symptoms you might be still experiencing. But it takes about 2 to 3 months sometimes for some symptoms to resolve after a medication adjustment from being out of range in the beginning. So it's just, there's a lot of challenges when it comes down to taking thyroid medication and navigating life after having a thyroidectomy. So on paper, textbook, by taking thyroid medication, you can still live and live a prosperous life. But there's challenges that you face with making sure that you are really taking the medication well to give you the most amount of energy and the best quality of life long term. If that makes sense.
I wanted to ask if you could just speak to the diets that you recommend across the treatment and survivorship journey. One thing that I think that you had brought up is just the concept of a low iodine diet.
Oh, yeah. So the low iodine diet is very specific to people that are going to be doing radioactive iodine 131 therapy. So this is preparing for radiation only. This diet, it's crucial in treatment in management of differentiated thyroid cancer. So particularly, with papillary and follicular. But this diet, it's prescribed for only a short period. So usually 1 to 2 weeks before radioactive iodine therapy or diagnostic scans. And the primary goal is to deplete the body's iodine stores to less than 50 micrograms per day. So making the thyroid cells and any remaining thyroid cancer cells hungry, so to speak, for iodine. So that increases the effectiveness of radioactive iodine treatment for improving the accuracy of diagnostic scans and radioactive iodine uptake to help prevent future reoccurrence. And this is something that I'm so passionate about because I've had to do this twice myself. And I've created a really amazing, complete 14-day low iodine diet meal plan, a comprehensive guide, and radioactive iodine 131 toolkit so people know what to expect. It's like way more than 100 pages, and I keep adding to it every day so that people have the option of, you can set it and forget it and do this meal plan because it comes with a grocery list and all that. But I have a lot of people that are living in other countries, and so maybe they don't have the food availability that I have on this meal plan, but it has a template basically to show how they can build their day. Because a lot of people, they have a lot of food fears around when it comes down to preparing for low iodine diet. The whole experience is very stress inducing and a lot of anxiety around it. You want to make sure that you're doing it right, and there's a lot of information that's online that's they contradict each other, and it's very vague because it's really hard to determine sometimes iodine levels. We have a lot of research on iodine levels of common food sources, but it's all dependent on iodine in the soil of that year where the food came from that you're eating. So anyway, I created a DIY template so that people can build their own, and I coach people through this basically too. So I use a chat walkie-talkie, so really giving them the most support through this, because again, I'm passionate about this because I wish I had somebody like me helping me through this so that they don't have to do radioactive iodine again, so that they don't have to get more surgeries again, to help really live a lifestyle to reduce risk and reoccurrence. And so for the low iodine diet specifically, there's certain foods to avoid. The major ones are iodized salt, which is the primary source of iodine in many diets. It should be avoided. And it's in seafood. So all fish, shellfish, seaweed products high in iodide should be eliminated. Dairy products like milk, cheese, yogurt, egg yolks. You can have egg whites, but egg yolks are not okay. Processed foods. It's very hard to know whether a food item has the salt is iodine free or not. And I go way in depth in my guide about this because there's so many online support group boards that say certain products are safe, like Trader Joe's, for example. It's mentioned. I'm not trying, and I love Trader Joe's. I'm not trying to rag on them, but just people, just to be aware, if you're preparing for the low iodine diet, it's just an example that there's certain organizations online or there's certain support groups online saying that their products are safe for the low iodine diet. But when I contacted them directly to get in writing, I say, hey, they say that they don't use salt with iodine, but they're able to sub different salts. So even though it says that they don't supply salt with iodine, what they can sub in with Himalayan pink salt, even though it says does not a sufficient supply of iodine, it's still considered a sea salt, which is not allowed on the low iodine diet. They can sub in for kosher sea salt, which is not allowed on the low iodine diet. So it doesn't specify that in the nutrition ingredients list, which is why it's a very overwhelming process that I provide support for and very specific at when it comes down to the low iodine diet. But the benefit and the good news is that there is a lot of foods that are allowed. It's just making foods at home. When it comes down to eating out, I highly advise against it, and that preparing your own meals throughout this whole time allows people to have the most and complete control, and to start preparing early by reading their nutrition labels sooner so they're more familiar with what the foods that they do have. And I have a huge extensive comprehensive list of hidden sources of iodine. Like Carrageenan is it's an ingredient that's used common as thickening agent. It's not cancer causing, by the way, but it's a known hidden source of iodine, which is in a lot of food and food products. This is why I highly advise everybody to work with me on the low iodine diet, because I know this backwards and forwards and inside out, and I've spelled it out because I want everybody to have really successful treatment. That's for sure. And as well as making sure that they have adequate nutrition, because a lot of people become even more fatigued because they're eating so much less, because meat has to be really restricted to no more than 3 ounces per day, or no more than 2 servings, 2 to 3 servings per day, which is about a 3-ounce serving size if you're going to have animal-based meat. And so to ensure that it's low iodine, because they eat, especially if we're talking about cows, they eat grass comes with the soil, iodine, or it's injected with salt solutions to help preserve it, there's iodine. So you always want to get fresh meat from the butcher so that you're controlling this as much as possible. And again, the low iodine diet is very specific to certain treatment for radioactive iodine therapy. When it comes down to just in general of like nutrition and lifestyle for thyroid cancer survivors, there's actually no specific diet, but there's certain thyroid cancer warriors and survivors that I've worked with that not only have thyroid cancer, they also have other autoimmune conditions that are related to the thyroid, like Graves or Hashimoto's. So if somebody has Hashimoto's, they do need to be more particularly careful on reducing or on eliminating gluten to reduce their thyroid antibodies for reducing inflammation in that way. Now, not everybody needs to eliminate gluten, but for them, that is one population that it is advisable, as well as there's a lot of celiac disease that can happen with the imbalance of thyroid that has been common. And if a person's diagnosed with celiac, then of course they need to avoid gluten. And there's certain populations that do need to be aware of those, but not everybody needs to, because I find a lot of people will overly restrict, undernourish, and that adds to the already fatigue and exhaustion that a person can feel after having a thyroidectomy. Some people that they may or may not need to eliminate dairy, but it's not entirely necessary as well. There's no real avoid lists besides the only 2 things for thyroid cancer warriors and reducing thyroid cancer risk and reoccurrence is processed meats and alcohol, and smoking is another one. But the 2 food groups especially are those 2 to really make sure that you avoid. Everything else, it's up to the individual. But when it comes down to diet, that is the best, honestly, is really to, as I always incorporate and encourage, is a more plant-based, encouraged diet, eating more plant-based proteins, eating more nuts, seeds, legumes. You can definitely have lean proteins. You don't have to be vegan, vegetarian, or anything like that. But it's always encouraged to be able to get more foods with fiber and more antioxidants from colorful veggies. I always encourage to get at least 30 different types of plant foods per week. So that includes fruits, veggies, whole grains, nuts, seeds, legumes, and herbs, fresh herbs as well, because they're rich in a lot of antioxidants, just to help reduce cancer risk and increase fiber intake to reduce other cancer risks as well. And other key nutrients, though, and to be sure, by also getting those types of foods, is that will help with increasing iron. Sometimes people, they are low iron after having a thyroidectomy, or they could be low calcium. That's another thing that I forgot to mention before, is that one of the complications from getting a thyroidectomy, a lot of the time, our parathyroid glands can be affected, and these little glands help manage our calcium balance, calcium and vitamin D balance, and it regulates calcium metabolism. So they might need to increase so they'll need to increase their calcium and vitamin D intake to maintain good bone health and prevent hypocalcemia. And especially immediately post thyroidectomy, that is something where I'll require supplements, but they can absolutely get enough calcium from a well-planned diet from their food. And that is something that I do and have worked with lots of thyroid cancer warriors, is not have to spend a lifetime living on supplements and chewing Tums like it's candy and that kind of thing, because that's miserable. I would rather people get the power and knowledge of really fueling their body with the nutrition that they need from their food and reap all of the benefits. And then although it's not specific to thyroid cancer, selenium plays a huge role in thyroid hormone metabolism, even after having a thyroidectomy and taking thyroid hormone. So just taking 1 to 2 Brazil nuts a day will give them that help that a lot of the time people are low on anyway. And because if you over supplement or you have too many, and don't all you need is 1 to 2 Brazil nuts a day. If you're allergic to Brazil nuts, there's other sources, but that is usually the easiest way to get selenium, is having 1 to 2 a day, so that it helps with health after having a thyroidectomy and thyroid health in general, because too much selenium could be a bad thing. So that's why that is just sufficient enough to help get the amount of antioxidant like property that you can get from it.
Well, Julia, was there anything else that you wanted to just add as part of the conversation on the Thyroid Cancer Awareness Month?
Yeah.
I think there was one more question before that one, Colin. What are some hot topics related to the treatment of thyroid cancer?
Oh, yeah. So I get a lot of questions. So a major question that I get is in relation to the medications, the GLP-1 medications and thyroid cancer interactions. And so what are they? GLP-1 medications, they're that glucagon-like peptide-1 receptor agonists. So they're the class of medications primarily used to treat type 2 diabetes. And a lot of thyroid cancer warriors and survivors that I've worked with, they are living with diabetes as well. So these drugs, they work on increasing insulin secretion, decreasing glucagon secretion, and slowing gastric emptying. So I always get the question, because they want weight loss. That's another big side effect from after having, so to speak, after having a thyroidectomy or a survivorship struggle, is weight gain because of taking thyroid medication. And even though if your labs are normal, I always like to say that without a thyroid, even with taking thyroid medication, your energy level, new normal, is probably like a 60 to 70% capacity at most from what it was before. That is like the best you can get, is like between 70% of 100 as of having a thyroid. So anyway, because of this sluggishness, it really comes down to discipline throughout the challenges, because I get the challenge of being exhausted all the time or feeling exhausted all the time, which is why building a lifestyle to really optimize and taking your thyroid medication and being a really good professional on that, basically, so to speak, to make sure you're maximizing your energy as much as possible so that your metabolism is as optimal as it can be for weight management. And they seek these medications because it was approved from diabetes, commonly treated for type 2 diabetes, but now it's opened up for just being treated for obesity and overweight. It's been opened up to a wider range of people, but it comes on with this warning, if anybody with a history of thyroid cancer, but particularly medullary thyroid cancer. I get questions a lot about the fear about, oh my gosh, but does it increase thyroid cancer risk, or is it safe to take? So the warning of medullary thyroid cancer, it stems from the findings in rodent studies. So GLP-1 receptor agonists led to the development of C-cell hyperplasia and the tumors in the thyroid gland. So, and the C cells produce calcitonin, which is a hormone involved in calcium homeostasis, and hyperplasia of these cells can be a precursor of medullary thyroid cancer. So, what the research says is that the findings are in animals. So, in animal studies, rodent studies, it's that these GLP-1 receptor agonists can stimulate C cell proliferation, leading to the hyperplasia and tumors. And so the effect, it's thought to be mediated through the GLP-1 receptor on C cells. And the relevance to humans is it's really uncertain because there's significant species differences exist in GLP-1 receptor expression and regulation between rodents and humans. And for human studies, there's not a clear, the evidence so far has not shown a clear increase in thyroid cancer incidence with the use of these GLP-1 receptor agonists, but long-term data is limited. I've worked with people that are taking these medications and they're generally viewed as safe, but I'm just a person that's always going to want to pitch it, even though it's harder, it's going to take longer, but I always encourage lifestyle and dietary recommendations changes first when it comes down to weight loss and weight management, because that is just the safest, because we don't know long-term effects of these drugs yet. And I just don't trust not having long-term data. No, it's just me. And I just want to always protect my thyroid cancer warriors and survivors as like I don't have any kids, but I feel like a mama bear wanting to protect my cubs. Those are the kind of things. But especially if somebody has medullary thyroid cancer, those would be the ones that, just because of that warning, they're the ones that are advised again. Studies have been monitored. They've monitored the serum calcitonin levels in patients that treated with GLP-1. But again, there's not consistent evidence of significant increases in humans. Again, it's cool. The pros that animal studies, they help warrant caution and further investigation. So it just shows how important that these like preclinical safety assessments are done, and ongoing surveillance helps monitor the real world incidence of thyroid cancer patients using these medications. But again, it's hard. The cons are just like data from rodents to humans is hard just because of significant differences, and then just lack of long-term data. It's just, yeah, that's what I would say. So it's safe, but as your thyroid cancer dietitian, I highly suggest working with me for diet and lifestyle changes, because it is possible to lose weight without the need of these medications. I've actually even had clients that have gained weight using these medications. But I always want to work with what people are interested in trying and doing for themselves, because it's their journey, and I want to support them so that they feel their very best and feeling heard, and just know that I completely understand the path of what it's like.
Well, is there anything else that you wanted to add as far as the Thyroid Cancer Awareness Month?
So some common thyroid cancer symptoms that I want everybody to be aware of. Says, how do you know? Because then I'll get asked, oh my gosh, I don't know if I have thyroid cancer. Some common symptoms, and sometimes people might not experience these symptoms at all, like me, for example. There's common symptoms to be aware of is a painless lump or swelling in the neck. This is the most common and often the earliest sign of thyroid cancer. And you might notice it, or it's most likely noticed during a routine physical exam. And that's why always, at minimum, go to your primary care appointment each and every year, get your blood work done, because in case of having nodules in the deep central neck, like I did, you might not get it on the physical exam. Your doctor might not feel it. And so your blood work of getting your thyroid labs, that would be indicated on your TSH level would show that there's activity, and T4 level. So that would be something that always go to your primary care physician. But anyway, so that would be a symptom to be aware of. So always doing a check your neck. You'll hear that, or you meant, and if you haven't heard it before, check your neck where you're doing a physical exam of your own neck in the mirror, and do that relatively consistently, as much kind of like a breast exam. Check your neck just to see if you notice any abnormal growths, lumps. It could be just a nodule, but still, it's better to be more proactive and being in tune and aware of your body of what's going on. Common symptoms would be like neck pain. Some people might experience discomfort or tightness in the neck area, especially as tumors grow. It can affect the person's windpipe, depending on where it's growing, as well as around their esophagus or their vocal cords, or so it's just feeling neck pain and strain, hoarseness, or other voice changes that persist for more than a few weeks. That could be a sign of thyroid cancer affecting the vocal cords. Difficulty swallowing. As a tumor grows and it presses on the esophagus, it makes it way harder to swallow. So clearing of the throat, or feeling like you need to be like like a lot more often and frequently than normal. Like it's not just phlegm. And I guess nowadays it could be even more challenging, especially after people getting COVID and long COVID. And that's something with that increased mucus is kind of, I guess, could be, so it's not always indicative of thyroid cancer, but that is a symptom, though, of knowing that it's that clearing of the throat and making swallowing difficult is just something to be aware of. Breathing problems, because if the tumor might put too much pressure on the windpipe, it can make breathing challenging. So like shortness of breath, the enlarged swollen lymph nodes, that would indicate that it's spread, or it might have spread, but again, check your neck. Fatigue is just always a underlying early sign of cancer in general. But again, even though it's non-specific, it is common for an unexplained fatigue could be an early sign of thyroid cancer. And a cough that doesn't seem to be caused by a cold or illness could be a symptom of thyroid cancer. And I want people to be aware of treatment effects or treatment complications that can happen from, say, getting surgery, thyroidectomy, is that there can be damage to the vocal cords and parathyroid glands, like I mentioned, or a chyle leak, because it's in that area where all the lymph nodes are. It's just very highly sensitive area, as well as nerve damage in case, depending on how they go in. I mean, they're definitely getting better when it comes down to surgery and performing thyroid surgery. I've even seen some like surgeries now where they're testing out going through like the lip, which is kind of crazy and wild. I need to like go back and look at it again, but there's really awesome new technology that they're trying to do to improve thyroidectomy surgery to get even better to minimize complications. For radioactive iodine therapy, that is something where radiation will cause dry mouth, changes in taste, and fatigue. I have a whole section on this in my radioactive iodine guide about how to prevent dry mouth, how to protect your salivary glands, and making sure that you don't have long-term damage. The external radiation therapy could be like skin changes, difficulty swallowing, and the fatigue. And for chemotherapy would be the common side effects of like nausea or hair loss, risk for infection, and side effects from targeted drug therapies like, diarrhea, liver problems, high blood pressure, which again, I all help support thyroid cancer warriors and survivors manage at no matter what part of their journey. Because once you become a thyroid cancer warrior, after you get a thyroidectomy, it doesn't stop there. What I would have to say, I don't mean this I'm a person where if you know that I'm saying something, that there's going to be stuff that I always talk about that's not going to be easy to hear, But at least knowing coming from me, it's the truth, because I would rather them be in the know than not in the know, to develop a plan and have the awareness, to have the power and knowledge. But having a thyroidectomy or having that surgery, your journey doesn't stop. You're not cured. There's a lot of doctors, or there's people, I've had a lot of warriors that have told me that their doctors have told me that they're cured. And that I don't like, that's kind of like false. Not that it's false information. It can be very helpful in managing reoccurrence, but there's still ways where reoccurrence can happen. So it's lifelong monitoring for reoccurrence after that. A lot of people, they can either get a thyroidectomy, and what I like to say, it's a one and done. You get a thyroidectomy, you do radioactive iodine therapy, if we're talking papillary and follicular, that you won't have any recurrence whatsoever, especially if you catch it in an early stage. Some people, they don't, based on the other types and subtypes of thyroid cancer and their reoccurrence. So like me, for example, I've had it metastasize in my lymph nodes. I was caught at a later stage, and I've had multiple surgeries since then. And so not everybody's story is beautifully unique and different. And this is especially why I'm so incredibly passionate about thyroid cancer awareness, being a thyroid cancer a dietitian that really hones in on specializing with thyroid cancer warriors and thyroidectomy warriors at any stage, any gender, because again, with this journey, it doesn't discriminate. And I just want to make sure that people feel really well supported and can really live longer and be stronger with dietary lifestyle changes to be able to really enjoy life, spend time, reduce cancer risks in general and other diseases, but to make more space in their mind for more memories with their family, friends, and really enjoy the beautiful things in life, because there's still so many beautiful things to enjoy and experience, because this does not define you. It's just a part of your story. And yeah, that's just why I'm extremely passionate. And
well, thank you so much for joining us today and just speaking to your expertise on thyroid cancer. And we'll go ahead and end there.
Thank you so much. I really appreciate you both for allowing me the time to speak, bring awareness, and share some insight.
Our podcast will discuss topics related to cancer treatment and the recovery process, including diagnosis, family support, resources, medications, and nutrition. We aspire to have conversations pertinent and relevant to the cancer journey. Thank you for listening to the Sick and Good podcast. We'd like to invite you to connect with us on our social media and Instagram and Facebook accounts. We're also happy to share that we have launched the Sick and Good podcast website, sickandgood.com. This website is a place to read our bios, subscribe to the podcast, listen to full episodes, or read full transcripts, and contact us with your questions or comments. We care about your listener experience and would love to hear from you to keep the conversation going on the topics of cancer and wellness.